why would you risk injecting someone else's stem cells into you when you can just inject the exosomes, which is safer, less expensive, available in the United States, and I just think more efficacious in general.
Yeah.
So I'm not a huge stem cell infusion person. People swear by them. I just think the risk of injecting someone else's cells with a whole I, the surface markers and all of the various things that you don't want someone's cells into you, you're just doing it, right? And you can't reverse it. Exosomes do, of course, have surface markers, but they're fewer, they're less allergenic, safer, and you could do them every day of the week if you really wanted to.
Hmm. So it's a real pleasure to have Dr. Sandra Kaufmann with us today. Welcome.
Thank you. It is great to be here.
So you are super passionate about longevity, supplements, and slowing down the aging process. And you got a training in your background in cellular biology and your medical practice and anesthesiology are really serving you well to take these deep dives into your passion and particularly exosomes. I was so excited to meet you again in London this last summer, and you were telling me all about exosomes. I was like, okay, we got to cover this topic. And I know when you take deep dives in something, you really take deep dives.
Yeah, I drown. Yes.
Totally drown in it. And so let's talk about exosomes. What are they? And again, and why did you even decide to go down this path?
Oh gosh, that is like saying, what's the meaning of life? So where to start? Where to start? So what are exosomes? On a very, very simple level, exosomes are part of things that a cell sort of excretes to send messages to another cell. And it can be any cell, because any cell can put out a molecule or a ball holding molecules. And then that package gets sent to another cell and it causes it to change in some way. It's just a message, right? Every cell puts out exosomes. And if it's an old person cell, it's going to put out old person messages. And if it's a perifetal cell or a younger cell, it's going to put out younger people messages, right?
Mhm.
And it turns out that all cells, also these little balls, I always like to think of them as little grapes budding off of a bigger cell, carry lots of messages in them, usually 200, 250 some messages. And sometimes these balls come in different sizes. So there's big ones, there's little ones, there's medium size, and they all have different names. But the ones that are important to us is a specific particular size, and the actual nanometers doesn't really matter. But these are the exosomes. So exo means out of the body, right? So the exosomes are coming out of the cell body. What do they do? It depends on the messages that are within that bubble or within that grape. The good news is that if we get them from perifetal tissues, it's usually messages of growth and regeneration. So you're taking messages and sending them to your own cells, and whoever's listening to this is probably not a kid. We're probably all older ladies and men, and we want our cells to get those messages. And it can actually rejuvenate and make tissues significantly more healthy.
Mm.
Okay, that's the basic thing, but there's lots of derivations. So
Yeah, when I was listening, you have this great video on your website, clubexosomes.com, and I wanted the way I understood in the very beginning, it sounded like they were byproducts of just cellular respiration or something. And I think maybe that's even what they thought it was in the beginning until they discovered, wow, there's these messages, and actually they can rejuvenate. So it's kind of a new thing that they've discovered exosomes, or is that not so new?
So yes and no. So it's really interesting. So Charles Darwin actually hypothesized that cells would exude these things, and he called them gemmules,
Oh, yes, yes, yes.
right? And I just think that's really, really amazing. I mean, that he would have guessed this. And I always thought that if I had my own exosome company, which I don't, but if I did, I think I would call it Gemule, just out of historic interest. But then we finally came up with pretty powerful microscopes, and you could actually see these things. And for years, people just thought that that was a cell's way of dumping garbage. You put your garbage in a ball and you sort of spew it out. And so no one wanted these things. It was cellular garbage. And it wasn't until maybe 5 to 10 years ago that people realized that this stuff is actually very valuable. Cells are very smart. So this was just valuable information. And to give people a little bit of background, an exosome is just the ball that's being excreted. And we talk about exosomes as if they're all these naturally occurring things, but you can actually engineer exosomes. So you have to sort of be careful when you're using lingo. So there are some people that can create exosomes and put things in them in labs, chemotherapies, vaccines, hormones, all sorts of things, and then put little messages on the outside of the bubble, right? Cell signaling processes that then send it to a place. So a lot of therapies are going to actually forward-thinking places are using it now. Ultimately, I think this is sort of the future of medicine. It's like you can put molecules on an exosome and it's like a mailing address and it'll take it to the place it needs to go to change whatever cellular processes you need to change. So that's sort of engineered. These are all natural, the ones that we use for longevity. And we get them mostly from perifetal tissues so that they do carry signals for regrowth and regeneration.
So the ones that are engineered, where are they getting these exosomes from?
So you have cells in a lab, right?
From what? Cells from a human tissue,
So it
or
just depends on what you're trying to accomplish.
let's say hormones. Let's say that like
So the answer is I don't know how they
oh,
do it, but I will tell you that
okay.
it probably takes some sort of human culture. I don't know what kind.
Okay.
Probably some sort of stem cell because they tend to make better exosomes, but that's just a guess,
Yeah.
right? You put the instructions in there for the cell to make whatever it is that you want, and then your cell just sort of packages it into these exosomes and ships them off.
So could you take an exosome, let's say from the fetal tissue, right? You want the young exosomes, put in hormones from, I don't know, like a 20-year-old or any hormone, I don't know, estrogen, let's say estradiol. And then can you deliver it somewhere and then we start producing our own estradiol again?
No, it doesn't work that way.
Oh,
So
okay.
to make your own, you have to regenerate the tissue to be able to make it.
Hmm.
If you put a hormone in a pack, it's just putting a hormone in an exosome is equivalent to just swallowing it. You're going to use it, it's a molecule, and then it's going to be gone forever. To make your cell be able to do something on a chronic basis, you have to change the DNA or change the way the DNA gets processed.
Okay. So it's not like, okay, there's no point in taking hormones, exosomes with hormones when it wouldn't make any difference than getting it through a cream or you just,
No,
and it would be too expensive
no.
and it wouldn't last very long, I'm guessing, right?
That is correct. But how to phrase this? So exosomes that are naturally taken from perifetal tissues will rejuvenate cells. As I said, 200, 250 some growth factors, non-coding RNAs, microRNAs, a whiff of DNA, a lot of growth hormone type stuff, and it goes to another cell, and it likes to go to cells that are inflamed. The addresses are like basically surface markers, and it will rejuvenate or tell that cell to act like it is younger. So in
Mhm.
terms of hormones, it should actually turn on your body's ability to make better hormones. But will it do that in isolation? No. It's going to do that as a massive package. Everything that you're sort of missing is going to be made better.
Mm. We just did a great interview with Zach Varkadis about ovarian rejuvenation. And I didn't know anything about this, but evidently it's been around for a while. And so it sounds like a sort of PRP or stem cell actually procedure where they inject the stem cells into the woman's ovaries and then she rejuvenates them and starts spitting out up to 60% more estrogen. That was one study that they did. So is how different is exosomes versus something like ovarian rejuvenation, or is there many types of ovarian rejuvenation and this could be just one?
So excellent question. But let's get to a different question first, which is what are stem cells,
Yes, probably a good
right?
idea. Yes.
Let's start there. Let's start there. So stem cells are obviously cells with a ability to create other cells. So one of your mesenchymal stem cells, as an example, or a pluripotent stem cell, will be able to differentiate and make other cells. That's one thing that they can do. The other thing that they do is they send out regrowth and regenerative laden exosomes. So if you have your own stem cells, so for example, if you go to a tissue bank, you can extract either your fat or your bone marrow, and fat's better, put it in a culture, grow it on a dish, and you can re-inject your own stem cells, reintroduce them to your body, and you will do significantly better wherever you put these stem cells. And that is a fantastic way of theoretically rejuvenating your ovaries, but it's also good for every other tissue in your body. The problem, however, is most people don't do that. Most people use someone else's stem cells. The issue with someone else's stem cells is that it's going to carry everything that's in the cell. It's going to carry the DNA, anything that, right? Everything that's in the nucleus, everyone else's mitochondria, their mitochondrial DNA, anything that that other cell carries is now being introduced to you.
Mm.
And tissues do seem to do well. There's two caveats. Caveat one is that most of someone else's stem cells get destroyed within a week or so.
Mm.
They get stuck in capillaries. They get destroyed by your spleen. They just don't actually become incorporate. Someone else's cells do not become your cells. They just
Mm.
really don't. What they do is they release a lot of exosomes. And it's the exosomes that's actually the curative aspect of most of the stem cell injections.
Wow.
Okay.
Okay.
So in my world, why would you risk injecting someone else's stem cells into you when you can just inject the exosomes, which is safer, less expensive, available in the United States, and I just think more efficacious in general. So
Yes.
I'm not a huge stem cell infusion person. People swear by them. I just think the risk of injecting someone else's cells with a whole I, the surface markers and all of the various things that you don't want someone's cells into you, you're just doing it, right? And you can't reverse it. Exosomes do, of course, have surface markers, but they're fewer, they're less allergenic, safer, and you could do them every day of the week if you really wanted to.
Hmm. You said that it's better to take it from the fat cell versus bone marrow. Why?
Because of something called the Hayflick limit. So if you're using your own stem cells can only divide a certain number of times, and then they just sort of stop, right? Stem cells can reproduce more frequently than regular cells because they have telomerase,
Mhm.
right? Telomerase increases telomere length as you are using it. Even so, even with telomerase, you're eating up the telomere length faster than you can put it back. So even stem cells have a limit to the number of times it can divide. So if you look at a stereotypical population of stem cells in your bone marrow versus your fat, your bone marrow turns over significantly more quickly.
Mm.
You're making a new set of red cells, for example, every 3 months. All of your immune cells are being turned over extremely quickly, right? Your fat cells, on the other hand, are just pretty much sitting there. I mean, if you're 300 pounds, maybe they're kind of active, but for a normal type body person, your fat cells are just sitting there. So their reproductive or replicative capacity is significantly higher.
Mm.
So when you want to take your own cells, that's sort of the way to do it so that when you put it in the lab, you have significantly more divisions available to you through the course of time. So they're good for about 10 years. You just keep milking off their prodigy. But at about 10 years or so, they're not really good anymore. They stop doing it and then game's off and you need more. But that's why.
So if you're in your 50s and you take your exosomes from your fat cells, then you have 50-year-old exosomes. And you
That is
just
correct.
mentioned it was better to get it from a younger exosome. So
No, absolutely. Which is why you can go through this whole autologous stem cell, autologous exosome business. And I know there are a few companies that are doing this. They will take your stem cells and milk off your exosomes and they swear that they're great. But again, they are 50 years old. It's just what they are. And there are several companies that use perifetal exosomes.
mm,
And they get them from perifetal stem cells. Usually it's placenta, amniotic, or cord. They get these from very healthy women who donate their tissues. They pretty much rule out any concomitant diseases, vaccination issues, blah, 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 blah. And then they choose the cells that they want. And then they milk off the exosomes, send them for third-party testing, make sure that they're safe, they're not carrying any diseases. And then they're available for consumption by the rest of us. And they really are incredibly efficacious. And I've rarely injected them into someone who says, "Oh, I don't feel anything." I will
mm.
tell you 90 some percent of everyone just feels great. I swear it's like the new panacea of life. Like, and people say, they ask, what should I expect? And the answer is everyone is a little bit different. People with sleeping problems tend to sleep better. People with skin lesions, it gets better. Aches and pains, they go away. It's just an extremely rejuvenating therapy. And if you're trying to deal with menopause, the answer is it's extremely helpful. Once you're in menopause, the symptoms can get better. And if you do it before menopause, you can actually sort of delay some of the onset of some of these symptoms. So it's extremely beneficial.
What are three ways exosomes can help a woman in menopause?
Number one, they're anti-inflammatory.
Mhm.
So as you get older, you get systemically inflamed. When you are in menopause, estrogen is downregulating, all sorts of like kaflooey hormony things are going on. But one of the big problems is an inflammatory state. That quelches that. You
Mm.
just feel better. Number two, your skin is going to be better. As we hit menopause, right? We all have that crappy sort of paler to us. That gets significantly better. And whereas I don't have direct evidence for it, I absolutely believe that your hormones are going to be better. Will you be able to not be on replacement therapy? Probably not, but maybe you need a lower dose. Your cells are just going to function more optimally.
Cool. Okay. So let's say we've reduced inflammation, we can improve our skin, and then we can improve the function perhaps of the hormones. So when a woman walks into your clinic or wherever you are and she says, look, I've got inflammation of my hips, let's say, and you would inject the exosomes directly into the hips, or does it not matter where you inject?
So it works incredibly well, both systemically and locally. And before I start this conversation, I will tell you that exosomes are not FDA approved for any injection anywhere into the body. It is supposed to be for topical use only. So if you go to any website of any producer of these things, there it says nothing about injection, and it's all sort of like foofy topical, blah, 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 blah. As a physician, we do it, and patients have to be informed that it's not FDA approved, and yet the side effect profile is extraordinarily low. People do incredibly well with it. So that's the caveat right there. So technically, I'm not supposed to advertise as IV injections. That being said, of course we do it. So for someone that has hip issues, as an example, what I generally will do is put part of the treatment locally into your joint or whatever hurts, and then another part of it through your IV. And these exosomes will get attracted to areas of that have an inflammatory state. So usually the dual modality is the most helpful for something like that.
So would, in this case of a joint issue where somebody has no more cartilage left or it's wearing down, is it actually rejuvenating the cartilage production?
That is an excellent question. I would guess, and again, I don't know if there's actually been studies on this or not. However, what it does do is it massively reduces the inflammatory rate. And when you think about bone and cartilage, especially bone, you have to think about there's osteoclasts and osteoblasts. Osteoclasts break things down. They destroy bone, they destroy cartilage, sort of. Osteoblasts build bone. And osteoclasts, the cells that destroy it, are activated by inflammatory cytokinins. So if you can turn down the inflammatory response, you're breaking it down less, which gives the osteoblast time to sort of regenerate. And this should work for chondrocytes as well, which is what makes cartilage. So exosomes don't necessarily increase the production, but they decrease the destruction, allowing you to self-heal. Does that
Mm.
make sense?
Yeah, it makes sense. So I'm wondering, let's say somebody complains about their hip, they get the injection directly into the site, and then they have the IV. But what if they also have a shoulder issue or they have gut issues? Because the once it's in an IV, you said systemic, would it go to the hip or just kind of like try to take care of as much as it can? Or is there a
No,
place?
that's a good question. So it's going to go everywhere that is inflamed. Becomes the art of it. You have to think of each little exosome, and they sell them in billions, which sounds like a lot, like billions and billions. Little Carl Sagan here. But we have so many cells in our body, and each exosome goes to a cell. So the more cells that you have that are inflamed, the more exosomes you need.
Yeah.
So, so if you've got one injury, you go, what? Maybe like a dose of X would be appropriate, right? But if you have seven sites, you're going to need a massively larger dose if you think that you're going to knock off all of those sites of inflammation. And it's also body size. A little person is going to need less than like 300-pound dude. It's just
It's
what it is. It's funny. I had this very muscly, I don't know, 5'11" dude in my office last week, and he'd gone and had some exosome therapy somewhere, and he goes, I just don't think it worked. And because he had popped a bicep, I think that's what it was. And he goes, I've heard that you could inject it locally. He goes, but that sounds painful. He goes, I don't know if I want to do that. So the good news, I'm an anesthesiologist. So I took out my itty bitty needles and I injected his arm, and we did the same thing I told you. We did the rest systemically. And I got an email from him 3 days later saying, oh my God, it's the first time he's been pain-free. Everything was so much better, blah, 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 blah. So I think it just depends not only on the type of exosomes that you choose, but how you administer them, where, and sort of how you divide the therapies. So there's a bit of an art to this.
it's amazing. It's amazing. So is it painful? Is it, I mean, I know you have a little needle.
Well,
Like if you didn't
so
have the
that's
necessity.
going to depend on who you ask. So what's really funny is I do a lot of people that like will have like a sciatic-y sort of pain, or they tweak something in their shoulder. And my goal is I have to stick the needle where it hurts the most. I will stick them and I'll move it around a little until they go, and then I'll inject it there. And they're like, that hurt. I mean, like, I'm sorry, but like it had to go where it's inflamed. So that does hurt. On the other hand, if I'm putting in areas that are not inflamed, it doesn't hurt. So I do a lot of women's and actually men's faces just for like skin rejuvenation. And I'll just inject it, doop, 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 and it doesn't hurt at all. Tissue isn't inflamed. It's a very tiny volume. It's a very tiny needle. People never know. I do a lot of scalps as well for men with sort of balding, and they do incredibly well.
How
But
much can they?
women are way tougher than men, by the way. I always think that's humorous.
I've heard that too, wherever I
Yeah.
go. And so if so, this is totally side note, you can rejuvenate a man's hair growth. Like how much can you actually? Because we can't expect if you're totally bald, there's going to be
Yeah,
full
yeah.
hair.
So it depends on the health of the hair follicle. Like if the follicle is still there, we can rejuvenate it.
Mhm.
And it's usually a combination of some oral supplementation as well as just injecting the stuff. Because PRP works as well, but PRP is just as old as you are, which is why I love exosomes because they're way younger. Um, so if the follicle is still intact, you can get significant hair regrowth. If you are bald as a bowling ball and you've been bald for 30 years, it's not happening, right?
Yeah,
I
yeah.
mean, relatively appropriate expectations.
What about there's 20-year-old, 20 something year old young men and they're starting to bald, right? It's
Oh,
they
yeah, I would jump on it immediately.
and they probably don't need the younger exosomes, do they?
No,
Or
no, they don't,
they're
because if you're 20, no, they just need PRP. Yeah, which is super easy. You draw people's blood, just spin it down, you separate it, and you re-inject it. And it's significantly easier. And a 20-year-old is going to have fantastic exosomes.
but wouldn't you think if the the reason there must be a root cause why they're balding other than genetics, or could you
Well,
find,
yeah,
isn't that maybe more sense to go find out the root cause?
so we don't know enough about premature balding to actually do anything. I mean, in terms of, oh, you've got a genetic blah, blah, blah. No one cares because there's no answer for it. Either you're starving and you're nutrient deficient, you're extraordinarily stressed, because stress will cause sort of hairs to die, or you're just damn unlucky. Regardless, it all sort of responds to the same sort of treatments.
Mm. So, what are you treating women who are in this perimenopause, menopause phase? What are you seeing? It sounds like the skin, on the face
Oh,
is.
yeah, yeah. So we have to remember as well that I don't immediately jump to exosomes with people. It's part of my longevity pyramid. So we start with appropriate supplementation, medication, light therapies, et cetera, et cetera, et cetera. And then once a month to once a quarter, we'll do exosomes. So it's in addition to all of the other things that people are doing. So the supplementation, it jumpstarts your sirtuins, it's NAD repletement, it's all of the other things that's going to make a perimenopausal woman feel significantly better to start with. So there's just tiers of improvement. So that's going to be tier one, tier two. And then by the time we throw exosomes on, people just really feel like they're back in their 30s and 40s. They're just doing so well. And some people come off of hormones, and some people still have to take some, not a ton, just enough to just sort of maintain it. And the key here is that if you don't start supplementation within 5 years of the onset of menopause, like your hormones, just your receptors and such downregulate, and then it's significantly harder to make up the ground, the lost ground. So as soon as you start seeing signs of issues, you really need to be sort of like really heavy-handed in addressing the issues.
Mm. Then do you ever talk about the diet and lifestyle and smoking and all that stuff
I
as part
think
of the foundation, or they're
by
not
the
going to do
time
it?
they get to me, they've already done that. Like no 400-pound woman that smokes has ever come to me and asked me about longevity. It just doesn't happen. Because honestly, I will crack up rudely and go, yeah, I can't help you. Like, right?
Yeah.
Everyone that comes to me is already eating appropriately, exercising. They've already got their red light stuff. They're doing their cold plunges, and they're like, now what do I do? Like, okay, like it's a good platform. Let's keep going.
What else do they come to you in other than the skin? Like, what are the top three?
Well, it's everything. My favorite cluster of people are actually aging athletes.
Hmm.
And it's really funny because everyone talks about how women are so much into this. Men are funny because they hit their 40s and they think that they're still in their 20s and they go out with their buds to play football or baseball or whatever it is, or they're still trying to lift the same amount of weight in the gym and things do not go well. And then they're not healing and they don't get it. And they come into the office and they've got a whiff of a beer belly and they're like, we just don't understand what happened. We were young and now we're not. And I go, okay, I can fix this. So I love that population because they just stare at you like little children, like, help me, help me. Women are smarter about the whole thing. They're like, okay, I've done my homework, I've done dot 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 dot. Like you need to help me through the next stage of this. And I go, God, I love educated people. Like, fantastic.
So then what are the top three, the complaints that they're coming to you with?
What the men?
No, the women. I'm talking about the
Women.
women
So,
in
so
perimenopause and menopause.
it's energy, skin, and sleep.
Got
That's what's killing women.
it. And exosomes can help with all of those.
All of them.
How does it
Yeah.
help with sleep?
So sleep. I love this. I love the topic of sleep. And I could be here all day talking about the topic of sleep. Circadian rhythms are not about going to bed on time or not staring at blue light or not eating after a certain time. Circadian rhythms, I know this is like contrary to what you've been hearing, right?
Yep.
Circadian rhythms are driven by six main proteins with accessory proteins and enzymes that cause you to fall asleep and cause you to wake up. And that's all manipulatable with dietary changes.
But you just said don't
No,
eat
not dietary, but
meat.
like things that you take supplement wise. As an example, there are two proteins called clock and BMAL1 that put you to sleep. And then there's two proteins called cryptochrome and period. And that's the negative regulator. Two put you to wake, two put you to sleep. And that makes you, right, have the cycle. And then there's oscillating factors. There's ROR alpha, and then there's reverb, and one makes it get bigger and one makes it get smaller. So this is all this complex set of molecular biology. And all of that fails as you get older. And it's driven by SIR2 and 1, SIR2 and 6, and your NAD levels, right? So if you fix those things, your cells will work better and they will oscillate according to the way they should, and then you will sleep. And if you're not sleeping, you're also not making 40% of your genome because sleep doesn't cause you to make 40% of your genome, but BMAL1 and clock, not only does it make you sleep, it activates the 40% of your genome. And a lot of that is all the stuff that you need to avoid menopause or do better in menopause. So by upregulating all of those proteins that I listed, and you can do that with oral supplementation, you just do better.
Which supplementation are you talking about?
That's a whole nother story. I mean, 2 and 1s are easy, right? NADs are easy. Like, here's one that most people haven't heard of. So ROR alpha. upregulate or it increases the vacillatory amplitude of circadian rhythms. And the thing that does that is something called nobiletin. And that is an over-the-counter agent. It comes from orange peel. It does a variety of things as well. And people just don't even notice that they go, oh, I just feel better. I'm sleeping better. It's the nobiletin.
And that's what I have in my primadine, spermidine, and in the gluten-free one. And didn't know that. I know that there was this word called nobiletin, and that's maybe why I get some feedback from women saying that they're sleeping better. That's
Yeah, and
amazing.
spermidine does it too. Spermidine interacts with a lot of the proteins involved in the circadian cycle, right? So the people that made that, Leslie and her folks, they're pretty smart people. They knew what to put in that to augment the sleep effects.
Amazing. So then, okay, so then you wouldn't even go to exosomes for a woman who's having trouble with her sleep?
Not yet, no.
Got it. Okay. So let's get back then to the exosomes. Are there any risks that happen? I mean, you said there's no side or very little side effects.
Yeah,
And
no,
what?
I've injected thousands and thousands of people by now. I have never seen a side effect that's problematic. Worst case scenario, people say, oh, we don't feel anything. That's it. They're extremely safe. So, in terms of side effects, not really. The key, however, is also sort of knowing what you're injecting into yourself. Most companies, they have to be absolutely frozen right before you sort of melt them out. Some companies like Juvexo has developed one that as long as it's refrigerated after a sort of defrost, it's fine for a little while. So that's helpful. Some companies sort of buy them from other companies and disguise it. They're not a manufacturer, they're just a distributor, but you don't want to buy them from someone else, the chain. You want to go to a company that actually just makes them themselves. And there are a few that do that, and they're fantastic. So that's mostly the placental. And then there are companies, of course, where you can get the umbilical or the like Morton's jelly or cord derived.
Mhm. Are there any contraindications? People who shouldn't be doing exosomes?
No. Well, I don't tend to inject people with active cancer. And I don't actually ever give anything to anyone with active cancer because optimization of cells doesn't necessarily mean I'm only optimizing healthy cells. I could be optimizing cancer cells. I could be optimizing senescent cells. So that we're not that advanced yet to be able to know exactly what to do with people with cancer. So I make sure that people are cancer free. They get a little note from their doctor saying I'm in remission. They're not taking any extra medications like tamoxifen or whatever to sort of like downplay things. So that would be truly the only contraindication.
Mm. So when someone's looking for a doctor to treat them with exosomes, they can go to you. First of all, I would if I were me, but maybe they can't or they're looking somewhere else. What are some of the key factors that they need to be looking out for to be sure they're getting like the good stuff or a good doctor?
Right now, it's the Wild West out there. I'm trying to think. Like, there's probably a dozen large quality longevity places around the country. And those are going to be fine. They're going to be trustworthy. Physicians know what they're doing, et cetera. I would be weary of a functional medicine doc that used to do something else. They've just decided to do this. They don't know what they're doing. That's going to be a little bit problematic. The other problem is it's going to be hard to find people that do this because you can't advertise injections of exosomes.
So
So
yeah,
if you are advertising it, don't go there because they shouldn't be.
yeah.
Right? It's sort of like the catch-22. You're trying to find something that they can't advertise for. So what are you going to do? So the only real place to do it is to look for like a very well established regenerative medicine clinic.
Yeah.
And they'll know what they have.
When you mentioned the country, you were talking about the US. So are there any other countries outside of the US where this is you can advertise
The
and
answer is I don't know globally what the rules and regulations are. I don't know. I need to find that out soon because I may be starting stuff in the UK, but I don't know yet.
hmm, I have to find out. I have someone I can ask, at least for Spain, and I'll get back to you. So then let's talk about the cost. At least in the US, I don't know, we don't know anywhere else, but how much does this cost?
So it's going to depend on the company from which you get them and how much you need. I usually do it in what I call just aliquots. which is usually like an $800, $900 package. And some people need one of those. Some people need two of those. Some people want five of those. And the cost comes down sort of like in bulk. So you get one, that's regular price. Two is a little bit less. Three, a little bit less than that, whatever, whatever, whatever. But so it just depends. So a standard person coming in for one aliquot of exosomes is somewhere between $800 to $1,200 sort of nationally.
That's so much cheaper than stem cells, which are 20,000 and up, at least
No,
in.
exactly. What I do is, at least for me personally, I inject an aliquot or two every month. And I think that it's the equivalent of a stem cell infusion, but it's better because it's more of a homogeneous level of these positive cytokinins.
What are you feeling when you inject yourself or see?
It's really funny. I don't feel too much anymore. Nothing ever hurts me anymore. But here's a remarkable thing. So I recently, literally 2 weeks ago, had a lower blepharoplasty. I was getting that little
Mhm.
fatty bulge that people get. And what's really funny is I was injecting my face with a lot of exosomes, and my plastic surgeon was laughing. He goes, "There is so much fat in your face. What have you done?" And I think we generated these silly pads. I'm like, ah, shit, maybe like I overdid it a bit. But what was really interesting is so I did it awake, a little incision or whatever, and I handed him a bottle of exosomes and said, "Please inject this when you're closing." Right. And he looked at me, he's like, he knows me. He goes, "Okay, fine, only for you." Okay, great. So we did it. And I went back 2 weeks later to like see my own patients. And the nurses were looking at me and they're like, "Didn't you have surgery?" I'm like, "Yeah, of course I did." Like, but there was no swelling, there was no bruising, everything immediately zoop. I mean, if you look closely, there's still like a little bit of lumpy bumpy, but all things considered, it's amazing how much faster you heal with these things.
Oh, I should have given it to my surgeon before when he was sewing me up in my hip.
Oh
That would have
yeah.
been an incredible way to rejuvenate. Next time, well, I got the other hip.
I honestly, it's the future. It's the future of medicine. It will be done eventually.
Yeah,
There's no reason not to.
seriously. So when somebody has an issue, I'm just trying to think of a woman. Okay, let's say she's got her skin. She's got skin flaccidity, she's sagging, or maybe she's got some liver spots or sunspots, complaining about her skin, crepey skin. How many aliquots or sessions does she need to do to start seeing a difference?
So you would see a difference after one, but you have to understand what it's going to do. You're not going to get rid of the liver spots or a lot of the sagginess. The skin quality will look better, but you need other modalities to sort of change back all of that. So you need to laser off the the discoloration. That's number one. Number two, you need laser and red light therapy and a variety of other things to sort of make the droopiness go away. When all else fails, you go to a surgeon and they cut out your droopiness, but we're all trying to avoid that. The other thing I'd like to do is there's a medication called pioglitazone. And so it's a diabetic medicine, but what it does, it's a PCG1 alpha activator, so it really upregulates your mitochondria. But one of the fun little side gigs is that it moves your visceral fat into your sub-Q tissues. And as we get older and women are very thin, you look very gaunt and skeletal. And you can actually put back some of the sub-Q fat by doing that. So that's
Oh,
a little sneaky trick there. Of course, maybe I overdid it because I made my fat pads too big. But exosomes, if you add all of those things together, like you can absolutely rejuvenate someone's face.
but wrinkles, no.
So wrinkles are tough, right? Because there's active wrinkles and then there's set wrinkles. If you Botox your face, you're going to get rid of any motion. It's a paralytic agent. So your active wrinkles will go away. The wrinkles that you just sort of have that are set there, that's going to take more time because you've got to basically improve all of the health of your skin so that your skin sort of contracts and that the wrinkles sort of kind of go away. So they'll help over time.
Meaning, like, how many sessions per year do you think?
So so again, I do it every month.
Mm.
And what you do is you just see these incremental pieces of improvement. And what's really funny, it's so addictive because you'll see it, it'll get better, and then it like wanes a little bit. And then you go, oh shit, and you do it again and again and again. And at some point you go, well, I have exceeded whatever my expectations were originally, but why not keep doing it? It just becomes this obsessive thing to do. And it doesn't hurt. It's a little pricey, but it doesn't hurt.
Mm. So is it kind of like PRP in the sense that you don't see the results until about 4, 6 weeks?
So exosomes, when you inject into something that's inflammatory, you usually see between 24 and 48 hours. Skin, it takes about 7 to 10 days.
Oh, that's pretty fast.
Yeah.
Really fast. Okay, cool. Okay,
But
next up.
remember that PRP, you're looking at your it's old cells and old cytokinins, old messages. These are baby messages.
That's cool. I mean, that's crazy. I am going to try it next time I see you for sure, because it's too convincing for me. Maybe I got to get to Club Exosome. So let's talk about Club Exosome and what that's all about.
Sure. So what happened is I started doing this sort of obsessively. And then a friend of mine, Steve McCain, who's an ex-Olympic athlete, he hit 50 and I mean he's a great biohacker. And he's like, "Well, can you inject me?" And I'm like, "Yeah, sure." And he was just thrilled with this. Like all of his injuries from days gone by was just all of a sudden significantly better. And so it started out as we do his friends in Vegas, all of his beat up athletes and beat up Circus Soleil folks, and I'm sure whatever. But I don't have the Nevada license at the moment, nor is any of this FDA approved. So it turned into a social club. So that way, I am not your physician. You're signing a consent form, and I'm in the process of getting a Nevada license because I'll probably end up doing a clinic there to make it a little bit more legit. But what we just do is people come to us because exosomes are in fact hard to find. So people fly in. It started locally and it's just grown and grown. We have people flying in from around the world for a weekend in Vegas, because why not? It's fun. And then to be injected. And we run it quarterly. Sometimes it's in a hotel, sometimes it's in this human longevity optimization center, which is a little bit more clinical, but it's sort of easier for me, but other people find it less enjoyable. But the point is that we are in Vegas quarterly to make this available to folks.
And the way I understood it when I spoke to you before is it is like a club. Like you don't just inject and go home. Like you hang out and you
Yeah.
have people are like-minded and probably exchanging a lot of information that's interesting to each other.
Oh yeah, it sort of becomes like the sort of like French salon sort of deal. In fact, when it started, we would give people appointment times. And then that just completely failed because people would all come at the beginning and then never leave. Right. And from my perspective, it was really frustrating because I'm injecting all of these people and I kept thinking the crowd would get smaller and smaller. And like it never did. I'm like, the hell are all of these people still doing here? But they do. It's like-minded people, fun things to talk about. It truly has sort of become a social phenomenon.
I want you to do this in like a resort or on the beach with palm trees. And I'm not a fan of Vegas. That's just not me. But I would say this is something for the crowd who wants to be a little bit, I don't know, a healthy
We can
crowd.
we can do it. It's really funny. We were supposed to do it at Jay Campbell's conference in like a month ago, I guess. I feel bad. All of these people signed up and then a hurricane hit.
Oh gosh, I didn't realize that. Yeah.
That was supposed to be in
Probably.
Tampa, to the beach, sort of on the beach, not quite. But yeah, that didn't fare well.
Oh, too bad. Well, yeah, there's room. It sounds like this is new, this is emerging, this is going to explode. This is so much cheaper and it sounds like even safer than stem cells. Why wouldn't you do this? And of course, the trouble now is finding somebody you trust and where it's done. If you can't find this stuff online, I trust you and I'm sending anyone I know to you and clubexosomes.com. Awesome. I mean, I can't wait to see you again. I don't know when London, going to see you either.
London.
Come down to Marbella. Hey, well, let's get around to people in Marbella. We've got plenty of people who would want treatments like this.
Oh, that
Now,
sounds fun. Yeah.
the wheels are spinning. Okay. Let's tell everyone where we can find you at Club Exosome without the S. I think I said Club Exosomes without the S, clubexosome.com. You've got a meet up in Vegas, December 14th. Is that correct?
I think so. Right. So if you go, you can either go directly to clubexosome.com and there's information there, or you can go to my personal longevity site, which is kaufmannprotocol.com. And there's a link to Club Exosome there. So many ways to get there. And then there's also, if people want to ask me questions directly about any of this, there's an email on my website, comes to me. I answer all emails, me, myself, and I. Takes me a little bit of time, but I do get to everyone.
Awesome. I'm going to have links to all of these things, your email, Facebook, Instagram, website, the club, Exosome, in our show notes. So before I let you go, what is the single most important thing a woman in menopause needs to know about exosomes?
Do them. That was a setup right there.
Just do it.
Do it.
Well, you'll certainly have a ball when you do it with Dr. Sandra Kaufmann. Thank you so much. And I will see you surely again very, very soon.
Absolutely.